So let me first try to begin by introducing our audience to Bezuclastinib. This is a highly potent and selective inhibitor of KIT D816V that is being developed for both advanced and non-advanced systemic mastocytosis. And folks would know that avapritinib is a similar drug, but what may separate Bezuclastinib from avapritinib and sort of set it apart is that it spares a lot of related kinases and also does not cross the blood-brain barrier. So these are some attractive attributes of Bezuclastinib, and there's been a lot of excitement and activity surrounding its development. So the SUMMIT trial is actually the non-advanced SM trial, and there is a separate trial, APEX, the advanced SM trial, and both are being presented at this ASH meeting. The SUMMIT trial, the current presentation, just to orient folks, is on the patients that receive the 100 milligram dose. So it's not everybody. It's the 100 milligram dose patients, which is really the go-forward dose in non-advanced systemic mastocytosis. And again, our audience can certainly check out the poster that Lindsay Ryan is presenting at this meeting. But as someone who has enrolled a lot of patients to this trial, this is a highly active drug, and it's very well tolerated, and the benefits are very readily apparent.